Hello, good morning, good afternoon, good evening, depending on where you're watching me from. It's okay again. There's something for us to learn today. Of course, that's why I'm here. In continuation of our series on hepatitis, today we'll be discussing what will people living with hepatitis do, part 2. Part 1 was people living with hepatitis that are not manifesting symptoms, headache carriers. Part 2, people living with hepatitis that are manifesting symptoms. The symptoms are that of, there will be yellow discoloration of the eyes, jaundice, there will be abdominal swelling, ascites, body swelling, they get weak easily, they will get tired easily, they will eat little and not be able to eat. Some of them are not able to eat at all. They will have vomiting, feeling of unwell, feeling of doom, and many others, and many other vague symptoms. At this time, greater than 70% of the liver has been affected or attacked by the virus. That's why the person is now manifesting symptoms. This is because the liver has the tendency to be able to regenerate. When the injury is getting to it, it keeps trying to meet up for function. But as at the time it's manifesting symptoms, greater than 70% has been attacked. So your target, for you that is already sick, your target will be to reduce the viral load, because the viral load is high. That's why the virus now attacking your liver, or immune system is down, which gave room for the virus to replicate and increase. So they will give you antiviral agents in the hospital, drugs like tenofovir. I will not tell you the drugs because it is not for you to do a self-medication. So meet the doctor to give you the drugs, okay? And they will give you drugs to protect your liver at this time, to supplement for what the liver would have been doing. They give you drugs that have got vitamins, multivitamins. You know, the liver is supposed to be the powerhouse of the body that process and metabolize these vitamins. So they will begin to give it to support it, okay? To augment for what it's supposed to be doing. And then you are supposed to go through a lifestyle modification, lifestyle changes. If at this time you are still drinking alcohol, then you are your own enemy, because alcohol itself can cause hepatitis, that is referred to as alcohol-induced hepatitis. If at this time you have chronic hepatitis B, you are still drinking alcohol, then you don't love yourself too. You're supposed to stop smoking. You're supposed to eat healthy. It's not everything you should eat. It's not everything that you should drink. You should not eat food that will put a burden on your liver at this time, okay? And this, the doctors, the gastroenterologists and or hepatologists will attend to when you present in the hospital. Take your medication seriously. Take your clinic follow-up seriously. The tests they'll be doing for you, and we include these ones, and the reason why they do it, I'll be telling you now. They will do hepatitis B envelope antigen. Envelope antigen is always high at that time because the virus is replicating. But when they begin to give you antiviral agent, the viral load drops, then hepatitis B envelope antigen is supposed to be returning to normal, or it should be negative, meaning that the virus has gone into remission. In developed countries, they do quantification of hepatitis B surface antigen, but they don't do it here, so I won't bother you with that. Another thing they can do, they'll do ferritin. Serum ferritin is always high when the liver is being destroyed, because the liver stores iron in the form of ferritin in the liver. So at the time the liver is being destroyed, it will leak this ferritin into the blood. So this is also used to monitor the prognosis or the progress of your treatment, if it's doing well or not. Another thing they will also do for you is alpha-fetoprotein, especially when you now have cirrhosis. People with liver cirrhosis, they'll be monitoring alpha-fetoprotein. Alpha-fetoprotein is a protein that is not supposed to be in the blood of anybody apart from a woman that is pregnant, because of the fetus that is in the womb. That's the baby that is in the womb. So if somebody with chronic hepatitis B with liver cirrhosis is now having alpha-fetoprotein in his blood or her blood, the person is beginning to develop liver cancer. They will use all this to monitor treatment. And they will do a liver scan too. A liver scan will enable them see whether there's a liver cirrhosis. Some people also have, especially the obese, a fatty liver, which further worsen the prognosis of chronic hepatitis B on the liver. Then it will increase the burden on the liver, and the liver tend to fail faster than those without a fatty liver. And again, they can also do a biopsy of a cirrhosis liver. Okay, when they begin to notice changes, they'll do a biopsy of that liver to rule out a cancer. What is important here is not these medical jargons I've just told you. What is most important for you that is manifesting symptom, or you already have a cirrhosis, follow up. Take your medication seriously. Follow up on medical checkups or the plan that your doctor has laid down for you. Don't break them, don't disobey them, because in next phase, there will actually be no help when the liver has failed. When you hear liver failure, You just be there supporting care. They'll be managing symptoms. If the fluid, water in the body is too much, they'll be giving you drugs so that you can pee it. And there's also the stage where people have kidney disease as a result of the liver disease that they have. This is not to scare you. It's for you to learn something. Hope you have learned. But ensure too that everybody in your house, they have taken vaccines so that you can protect them from being infected by you. It is better that you are the only one that is battling than you now have your wife and children battling or your husband and children battling with you. Hope you learned something. Bye.